Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert, and I am sitting in my hotel room in Hawaii, and I am on by Zoom with Dr. Millicent Ravello, who is sitting in Los Angeles, California. How are you doing, Millicent?
I am doing really well. Usually I would say Los Angeles is a great place to be. Right now, I'm thinking you're in a greater place to be. A little jealous, not gonna lie.
No, it's you should be, actually. This is pretty sweet. That's all I can
That's
say.
an appropriate sentiment, yes.
Yeah, absolutely. However, I had to revisit the case that you did last week, this double bubble case, because it was so severe that I think kind of walking through the options for treatment of the double bubble, which is when the breast implant drops below the breast gland in the breast augmentation, basically in a malpositioned implant from breast augmentation. And this one that you did was so severe, and I'm so blown away by it, that you have to put the before and afters up on the podcast site, on your site. You have to put those on a billboard on Sunset Boulevard, because anybody who has this problem should be going to you. You nailed it on that case. And I want to talk about the ways that you can fix the double bubble.
Well, thank you. It was challenging. That was definitely a tough case, I think, is an understatement. But a double bubble is something that is really only seen in an implant patient. You know, someone walking around without implants is never going to have a double bubble deformity. This is specific to patients that have breast implants. And the problem happens when the native fold, it's called the IMF, or the inframammary fold. It's that distinct fold under the breast that separates the breast from the abdominal wall. It's an actual anatomic structure. And when you have implants in place, the implants are supposed to sit right on that fold, and that's what keeps them under the breast. Now, in some cases, sometimes intentionally, sometimes not intentionally, that fold is violated or it's released. And now there is direct continuity between the breast and the abdominal wall, and the implant falls below the fold, and it sits in a very awkward, malpositioned place, which is what happened in this patient on both sides, on both breasts.
And they were put in through the transaxillary approach, which I find to be, it's always kind of iffy. I don't love it. I do it once in a while. But when you go transaxillary, what I find is that the implants either ride too high, or you release the fold too much and they ride too low. And, you know, this can happen with any approach, but the reality is with your patient, I've never seen one that was so awful, and it was really, really out of whack. Those implants were sitting way low, probably 5 centimeters below the inframammary fold, if I'm, not mistaken. And it just was totally weird looking.
Yeah, it was pretty bad. The implants were probably, when I measured it, they were about 3.5 centimeters on each side below the fold. And the implants themselves were really large. So that made it even more challenging, because now you're dealing with a lot of extra weight on the breast and on the skin. And so any double bubble deformity, what you actually see, the reason it's called a deformity is because you have the implant, and then you have where the old IMF, where the old fold is, and that memory is still there on the skin. So it is still a distinct crease on the skin. And then you have below that the new fold, where the implant has sort of found its final resting place, which is the new fold. And that's what was a couple centimeters too low. And so it's a double bubble, because you have the implant on top sitting under the breast, then you have the old fold making a line, and then the rest of the implant sitting below it. And then that's, it's the double bubble. And it's a big problem, because it's just really hard to fix, and there's no way around it other than by doing a revision surgery.
Right. And the way that you did this was you used a device called Galaflex.
Mm-hmm.
I mean, I'm sure you did fold suturings. And I want to point out to everyone that the inframammary fold is an anatomic structure. You can't obliterate it. You can't get rid of it. I mean,